Hello, I'm Dr. Jane Woyka. I'm a menopause specialist and I'm also a private general practitioner. HRT is absolutely safe, providing it's given at the right time, started at the time of the perimenopause, and not given to the women who have medical conditions which mean they cannot take it. So that's women who've had hormone-dependent cancers, who've had blood clots, or recent heart attacks or strokes. HRT does not cause breast cancer. What we do know is that if you use a combination of estrogen and progesterone for more than 5 years, beyond the expected age of menopause, we do see a small increase in the number of women who present with breast cancer. And I'll put those numbers into perspective. So over a 5-year period, we would expect out of 1,000 women, 23 women to get breast cancer. Now, if all those 1,000 women are given HRT, we see instead of 23 people getting breast cancer, we see an extra 4 cases. So 27, 28 women getting breast cancer. But those women are no more likely to die from getting breast cancer. It's just that they develop it, and as soon as they stop taking HRT, then their risk of getting breast cancer goes right back to 0. So it doesn't increase your risk of dying from breast cancer, but it might increase your risk of developing it. Some people say that taking HRT simply puts off their menopause. So they take their HRT for a few years, stop it, and hey presto, all their menopause symptoms are still there. And actually that's not surprising, because if you only take HRT for 2 or 3 years, and we now know that the average length of time you're going to get hot flushes for is 7 years, it's no great surprise that if you only take it for 2 or 3 years and then stop, then you've still got several years of hot flushes to come. So menopause is a much longer time for symptomatology than we had appreciated. It's very important that women get proper help at the time of the menopause, because around the time of the menopause things change quite a lot. A very good example is osteoporosis. So the rate of bone loss at the time of menopause accelerates hugely. So you develop osteoporosis around the time of the perimenopause. So you want to be acting earlier with your HRT. Every woman's menopause is completely unique. It is really different. You'd be staggered at the difference that people experience from even things like hot flushes. So a hot flush might be just a little feeling of warmth, which isn't particularly troublesome. It could be an absolutely horrific experience whereby somebody has a sense of impending doom and great anxiety, and then they become really hot, might be very sweaty, might last several minutes, and they actually feel absolutely shocking, and there's no way they can continue doing what they're doing. So they can't stand in front of a class, they can't give a presentation, they actually can't even concentrate on what they're doing. They feel so dreadful. So there's a great range of level of experience of even simple things like hot flushes, vasomotor symptoms. If you're having a tricky time over the menopause, the first thing I would suggest you do is have a look on the websites, do some reading, but pick up some good websites. There's an awful lot of rubbish out there. Look for websites such as British Menopause Society websites, Women's Health Concern, Menopause Matters, even the NHS menopause websites are very helpful. And inform yourself. Understand a little bit about what to expect, and don't be quite so concerned about it. Do some reading. There's still an awful lot of doctors out there who consider that HRT is dangerous, and you need to probably arm yourself with up-to-date recent information. NICE guidelines came out 18 months ago, and they're very clear that hormone replacement therapy is very safe for the vast majority of women and actually significantly improves their quality of life and their long-term health. But get yourself informed, go to your health professional, your doctor, your practice nurse, and if they don't speak the same language as you, then ask to be referred, if you can, to a menopause specialist unit. There aren't, unfortunately, enough of those around, but there are certainly some very good units in certain areas.